Dr. Jason Saunders here with HBOT USA, continuing our conversation about oxygen. So first, I just want to thank everybody for the comments and the feedback in the previous videos that we've been making and releasing. Our primary goal here is just to help educate people on the importance of oxygen, how many different things oxygen does inside of our body, and that there's so many different delivery systems for oxygen, and that each delivery system might offer different benefits. And the more we understand this, the more we are going to simplify our approach to so many health conditions and concerns out there, and that using something as safe and effective as oxygen can have so many different benefits inside of our body. And so today we're going to be covering ozone therapy. But before we do that, I just need to talk a little bit more about oxygen, because again, even though there are different delivery systems, oxygen on a whole has a very specific role inside of our body. And when we understand that role, we can then look at the different delivery systems that we have and understand how different delivery systems may impact our body as a whole. And so a lot of times when I'm talking about oxygen, I describe it as a nutrient. By definition, a nutrient is a substance that's required for our body to grow and maintain life. And so 100% oxygen is a necessary nutrient, and it plays a critical role in so many processes inside of our body, which we'll cover. So if oxygen is this substance in our body that's required for growth and maintenance of life, what exactly is it doing? And so to summarize it very simply, it has two main roles. It's a signaling molecule and it's an oxidizer. As a signaling molecule, what that means, our body communicates with itself, and our body is constantly reading the outside world and trying to understand or create appropriate responses to those signals. And so oxygen is used in many ways to modulate the immune system, to increase immune activation or increase or decrease the inflammatory response to different types of, either trauma or invasions. We use oxygen as a signaling molecule for understanding how to increase or decrease the delivery of oxygen to our cells. Like, in other words, how much we're breathing in, and then how much should we be delivering to our cells. We use signaling to determine that. And in fact, in 2019, there were a handful of researchers that got the Nobel Prize in Medicine for discovering a thing called HIF1, hypoxic induction factor 1, which, these hypoxic induction factors are literally signaling molecules, and they help tell our body how to respond to changes in oxygen that we're exposed to or changes in pressure that we're exposed to, because both pressure and percent oxygen have a very distinct reaction inside of our body in terms of helping our body understand what it needs to be doing in relationship to oxygen absorption and dissociation. So one, it's a signaling molecule that our body needs for communication, and two, it's an oxidizer. What does that mean? It means basically that it accepts electrons. So there are so many chemical reactions in the world, and many, many more inside of our body, that basically rely on our ability to transfer electrons. So the most simple version of this is a fire. So whether that's an engine running or a campfire that you're building, they talk about a fire triangle. We need an ignition source, we need a fuel, and we need oxygen. Those three things combine for our ability to have a chemical process of burning something. And so inside of our body uses oxygen as an oxidizing agent, and that helps us burn fuel. So for us, a fuel could be a sugar, like a glucose molecule, or it could be a fatty acid or a ketone. And so we have this fuel that our body, we put inside of our body, we mix that with oxygen, and we have a chemical process of combustion, which allows our body to make energy, make cellular ATP. And so it plays this critical role in redox, reduction and oxidation, which is a balance of chemical reactions that help us modulate our metabolism. It helps us modulate inflammation. It helps us fight infection. And so it plays such an important role in balancing the chemistry inside of our body. So what is ozone? Oxygen by itself, naturally occurring oxygen in our atmosphere, is O2, meaning there's an oxygen and an oxygen, they travel together. They're bound together. And so naturally occurring oxygen is typically found as O2. So, and it's in O2, it's a very stable molecule. So when we breathe in, the air that we breathe is 21% oxygen. And when we breathe in and we absorb oxygen, these O2 molecules are absorbed into our system and are used for all these different processes. We cover them a lot in other videos, but just to name a few, it increases immune activation, it mobilizes stem cells, it reduces cytokine storms and cytokine inflammation, it helps us heal tissue, it has growth factor stimulation, it has brain-derived neurotrophic factor stimulation, it helps angiogenesis, so it increases our ability to rebuild the microcirculation, which allows gas exchange to occur in the first place. So it has so many different roles inside of our body, and it stimulates a lot of these growth and repair factors that our body needs to heal and to fight infection. And so naturally occurring oxygen is O2, ozone is O3, meaning literally there are 3 separate molecules of oxygen bound together. Now, O3 also exists naturally, but it's called ozone. There's an ozone layer in our atmosphere. And so much higher up in our atmosphere than where we're living, stratosphere, in higher elevations in the atmosphere, there's this ozone layer. And what's happening here is that oxygen, which is in our environment, is absorbing some of the UV light from the sun. And as it absorbs the UV light, it breaks O2 into pieces, and the O2 starts to bind to other, or I should say, as the O2 is broken into pieces, you have a singular oxygen that binds to another O2, and you get this O3. And then as that drops down, comes back into the lower part of the atmosphere, it breaks back into oxygen, and so it just recycles itself. But what all that absorption of UV light, one, that's protecting us. So, life on this planet wouldn't exist without a proper ozone layer in our atmosphere. And it helps to recycle this O3 to O2 within the atmosphere that we're living in. And so it does exist naturally, but it doesn't exist naturally typically, at sea level where I am now. But what we know about ozone is that it's an oxygen molecule. It's just a different type of oxygen molecule where there's 3, and it's less stable than typical oxygen, O2. And so we could use O3 therapeutically. So we have tools now that are ozone generators. So what they're doing is they're taking either, from an oxygen generator or from 100% oxygen tank, and you put it through an ozone generator and it will create O3. And there are multiple ways of delivering O3. You could put it in a room and have it just generating it through, usually with an air purifier and just breathing it in. You could do IV ozone, where you're infusing your blood with ozone. There's insufflation, there's ear insufflation, rectal insufflation. So there are multiple ways of delivering ozone to the body. And what we're delivering is O3 molecules. Now, there are times where O3 might be more productive than O2. Particularly, we were saying that O3 is a little bit more reactive. And so in times where oxidation, the oxidative component of oxygen, is the goal and the more important piece of the puzzle, O3 might be a better tool. So O3 is going to react very quickly, meaning oxidation, what I was saying before, it's going to accept electrons. Well, O2 is the stable molecule. So yes, it will accept electrons through the combustion process, but O3 is ready to roll. That extra oxygen is going to jump right off and bind to other electrons very, very, very quickly. And so in times where you want to fight infection, in times where you might want to upregulate mitochondrial function, in times where combustion and reactivity, the reactive oxygen species, the oxidative effect of oxygen is the critical component, O3 is going to have a much higher propensity to do that than O2. Now, it all depends, which therapy is the right therapy. We don't always know. And so sometimes it's also going to be a combination. So if you have a way of increasing your total O2, we already know that if we bring in naturally occurring oxygen, O2, when we breathe, it's going to do all the things that we need oxygen to do. So it's not like O2 is deficient in some capacity to respond inside of our body. So if you can increase the total oxygen, the total O2, you're going to get an increase in all of these reactions as well. And if you can increase O3, you're going to get a lot of the same signaling and oxidative effects as well. So the question becomes, which is the better tool and when? And to be honest, in many cases, we don't really know. But what we can say is increasing, what we could say is this. We normally get a certain amount of oxygen every time we breathe. And that certain amount of oxygen is enough for this moment. It's very difficult for our body to increase its capacity to absorb more oxygen than we need in any given minute. It's a very efficient system that way. So one of the ways we can increase the total oxygen we're getting is hyperbaric. By using pressure, we've talked about this in other videos, by using pressure and different percent oxygen, we can dissolve a greater degree of oxygen into our system, which allows our body to have more oxygen to do all the things that oxygen does. Another way to increase your oxygen inside your body would be to use ozone, O3. So instead of just getting O2, in some capacity you can get O3. And O3 is going to release this extra oxygen very rapidly, which is going to have a very strong oxidative effect, which, like I was saying, the oxidative effect could shift reactive oxygen species very quickly. It could help our body fight infection. It could improve some of our mitochondrial function. Now, the truth is probably some combination of both. Because O3, you can only take in so much O3 at a given time. You can't just put a mask like you could with oxygen. You can get 100% oxygen, put a mask on and breathe that, at least for some period of time before it becomes toxic. You can go in a hyperbaric chamber and breathe 100% oxygen or 21% oxygen under pressure. But we can't just get a mask of ozone and breathe that in. That would be toxic. So the amount of ozone that we can take in at any given time is also limited. So we might want to bring in some amount in O3 that's got a very reactive component to it so that the oxidation level increases greatly, and some extra amount of O2 as a more stable version of that same molecule. So the idea here is just to say, listen, they're all good. Even EWOT, we covered that in another video as well. You could check that out. EWOT is another, it's exercise with oxygen therapy. It's another way of delivering extra oxygen. The key here is that we know that oxygen is a critical nutrient our body requires to function, and we don't get extra oxygen very easily. So there are only so many tools that we have to deliver extra oxygen to increase our capacity to heal, increase our capacity to fight these infections, increase our capacity to burn fuel, whatever the goals are. And three of the more prominent versions are EWOT, hyperbaric, and ozone therapy. And they all have a place in this entire model of healthcare. And while they all deliver increased oxygen, they all do it in a slightly different way, which makes their pros and cons or their benefits a little bit different, yet similar in that they're still providing excess oxygen. So I hope that helps. I hope that at least introduces people to what ozone is and how it works. And I look forward to your comments and questions, and we'll create more videos to answer those questions. Thanks a lot.